Hello and welcome to Get Ready for Fly-In Day, June 6, 2017. My name is Catherine Burland and I'm ANCOR's Director of Public Policy. Whether you're joining us in DC on June 6 for a Fly-In Day or making visits in your home state with your senator's home office over the Memorial Day recess, this video will help prepare you to talk about the American Health Care Act, or AHCA, as I'll be referring to it. Before we talk about your Hill visits, let's go over the basics of Medicaid. Medicaid is a health insurance program paid for jointly by states and the federal government. Currently, for every dollar a state spends on Medicaid, the federal government also pays in at least $1, and in many states spends even more, up to 70% of the total costs in the state. People who qualify for Medicaid are low-income seniors, people with disabilities, some children, and pregnant women. The Affordable Care Act allowed states to also use Medicaid to cover low-income adults. Some states do so, and some do not. Medicaid originally covered mostly medical services, but over time has expanded to cover more services. Many home and community-based services in your state are paid for by Medicaid, including employment supports and certain transportation expenses. You may not realize that services in your state are being provided by the Medicaid program, but more often than not, they are. Now that you know more about why the Medicaid program is so important to services in your state, let's talk about why ANCOR and many other disability organizations did not support the American Health Care Act and asked lawmakers to vote no on it. The AHCA makes several changes to how health coverage works. Most importantly for you to know is that it would change the way Medicaid is funded. Currently, states spend money on Medicaid, and then that money is matched at least dollar for dollar by the federal government. So the more money a state chooses to spend, the more money it gets from the federal government. There is no limit to what a state may spend or what a state may draw down in federal funds. One big change the AHCA would make is to set a limit on how much the federal government spends on Medicaid programs. It would impose something called a per capita cap, which means a fixed amount to spend per person in the program, regardless of how much the state contributes. The amount would probably not be enough to cover the actual cost of services, leaving states with having to cut services or cover fewer people. The reason to make this change is to save the federal government money, which it would, by cutting somewhere between $839 billion and $880 billion from Medicaid over 10 years. There are other provisions in the AHCA that ANCOR and other groups are concerned about. Remember on the last slide where we learned that the Affordable Care Act gave states the option of covering more people through Medicaid? The AHCA would not let states do that anymore. So while people with disabilities, seniors, pregnant women, and some children would still be covered, low-income adults would not. It's estimated that around a third of the Medicaid expansion population are people with disabilities, even though they are not in traditional Medicaid programs. Another change would be to charge a penalty of an additional 30% in premiums for people who have a break in insurance coverage of more than 2 months. The AHCA would also allow insurance companies to charge more in premiums for higher cost populations, like seniors and people with pre-existing conditions. Finally, it would allow states to set essential health benefit requirements instead of requiring the 10 essential health benefit categories established by the Affordable Care Act. Some things that are required to be covered now are emergency services, hospitalization, and also habilitation and rehabilitation services and devices. Under the AHCA, it would be up to states to decide whether to require insurance plans to cover these things. The House of Representatives passed the AHCA on May 4th, and the bottom line is that it fails people with disabilities. First of all, it hurts states. It significantly cuts funding to the Medicaid program and puts responsibility on states to pick up the costs while states are struggling to do so now and waiting lists are growing. Next, it hurts workforce development. By cutting funding, it will worsen the workforce crisis for direct support professionals who support people with disabilities. It hurts children with disabilities. Federal Medicaid funds contribute around $4 billion annually to defray the costs for special education programs provided by public schools. And also, it's bad for business. It expects private providers of community disability services to operate under cost and makes the safety net for people with disabilities a system of impoverishment. These are the issues we want you to take to your senators. We'll have written talking points and leave-behinds for you to use in your visits that give more detail on these points for you to use. And just to drive this point home, costs, that's the red line there, are projected to grow faster than the rate allowed by the AHCA, that's the blue line. Even though the first year or even 5 might still be funded at or near current levels, changing the way Medicaid is funded means that over time there will be a shortfall, not enough money coming in to cover costs. This is going to hurt people with disabilities who won't be able to get the services they need. Before we move on, one more note on process and where we are now. The House of Representatives passed the AHCA on May 4th. Every Democrat and 20 Republicans voted against it, but there were 217 votes in favor of it, which was just enough to pass. We're targeting the Senate in June, but I know that some of you will want to take the opportunity to visit your representatives as well. So if you do, make sure to look up how they voted. This slide has the list of the 20 Republicans who voted no on the AHCA in the House. Now that the AHCA has passed the House, it goes to the Senate. Mitch McConnell from Kentucky, the Senate Majority Leader, has put together a working group to work on their own version of the health care bill. Although the work group has 13 members, shown here, Leader McConnell has said that input from other senators is welcome. If the Senate does pass its version of the AHCA, then it will go through a process that's known as a conference to work out differences between the Senate and House versions. Congress members are going to be back home over the Memorial Day recess from May 29th to June 2nd. This is a great time to set up a meeting with them in state if you can't come to D.C. You can also join us in person in Washington, D.C. for our Fly-In Day on June 6th. We will have materials available for you, and ANCOR staff will be on hand to answer questions and help you with any logistical questions. And you can even do both. It's a great idea to form relationships with both the national and the in-state offices of your senators. Next, we'll go over how to set up your visits and what to do once you're there. There are 5 steps to a successful congressional visit. Step 1. Locate contact information for the congressional office. We'll show you how to do that on the next slide. Step 2. Call or email the office to set up an appointment and identify the right staff person for your issue. We've done that work. We've identified the people for you. We'll go over that as well. Step 3. Plan out what you're going to say and who is going to say what if you are going in a group. Step 4. Plan your travel to the office. And step 5. After the meeting, send a thank you email and any follow-up information. We have a great tool available to you on our website to find information on your senators and representatives. Go to amplifier.ancor.org and put in your zip code in the box right there. Click search and you will get to all of your elected officials. We also put together a spreadsheet of the health staffer and scheduler contact information for all 100 senators. That link is listed here, and I'll also put it in the information section of this video as well. This is the information for the specific person you want to contact to set up your appointment and who to meet with on your senator's staff. When you do the search for your members through our Amplifier site, you'll get a lot of great information on them, including a link to their official website, committee assignments, and office location. It's a good idea to bookmark this page for easy reference. First things first, you need to schedule your meetings. Contact both your senators now to schedule a visit. Senators' schedules fill up in advance, so the sooner you do, the more likely you are to actually get a meeting. Usually, meetings are scheduled at least 2 weeks in advance. You can visit www.disabilitysos.org to find a list of in-state Senate staff who can schedule the meeting for you. Below is the text of a sample email that you could send them. Make sure that you personalize the areas that are bolded and anything else you'd like to do. If you do come to DC, or even if you're doing this in-state, you'll need to plan how your group is going to get to the office. In DC, you have lots of options. You can Metro, you can taxi, you can Uber or Lyft, or you can carpool. You'll want to save a map of the congressional offices to your phone and also maybe print one out. Definitely plan to arrive at least 30 minutes in advance to allow time to get through security, locate the office within the building, and review your talking points. In DC, House and Senate office buildings will have you go through a metal detector and place any bags through an X-ray machine. Photo ID is not required at congressional office buildings, but it is required at the Capitol, Capitol Visitor Center, and federal agency buildings. With logistics out of the way, let's look at how to actually prep for your meeting. Before your meeting, do some homework. Check out your member's website, the committees he or she serves on, his or her voting record, and positions on key issues is all good background to be familiar with before you meet. Remember also to be familiar with how representatives in the House voted for the AHCA in your state. Review ANCOR's information and talking points so you get a better understanding of key issues. Decide within your group what you are going to talk about and assign roles in advance. Use personal stories as much as possible and try not to read from a handout. Just be yourself. Now, I know it's easier said than done, but the most important thing is to just relax and tell your story. Maintain a polite, respectful, and friendly tone. Stay on point. Remember to tell stories that relate to the issues you've decided to discuss. Anecdotes are great if they're on point. If you don't know something, it's okay to say so. Don't make something up. Offer to find the answer and follow up with it. And don't get tripped up on trying to recite facts and data that you're not familiar with. That's why we have leave-behinds and follow-ups. There are 3 parts to a Great Hill visit. First, you'll introduce yourself. You'll frame the issue and make the ask. In other words, who you are, why you're there, and what you want. The first thing you'll do is introduce yourself. This is the who, what, when, where, and why. So who, give your full name and talk about your role in the organization if you're there on behalf of an organization. For the when, talk about how long you've lived in the state, talk about how long you've provided services, talk about how long you've been in the field. For where, talk about where within the state you live or work or provide services. For the what, talk about the types of services that you provide or use and where they're provided. Are they at work? Are they at home? Talk about the supports within the community that you provide or use. For providers also, talk about how many people you employ and how many you support in the senator state. And of course the why we'll talk about a little bit more as we go through the slides, but really the why is why you're there and why you care about this issue, and it comes down to empowering and supporting individuals with significant disabilities to live meaningful lives in the community, whether that's for yourself or for somebody that you know. So step 2, you want to frame the issue. Tell them why you're here. On this one, you're concerned about the impact the AHCA will have on people with disabilities, especially because it cuts from the Medicaid program, which provides community services for people with disabilities. It really is that simple. Keep it simple. Connect the dots. Help your staffer by explaining that you or people you know depend on the program's Medicaid funds. Tell your story so they understand how serious it would be to take those programs away. And then finally, show the problem. Use ANCOR's talking points and resources to highlight how those changes will exacerbate the workforce crisis, impact Medicaid eligibility, fail to cover actual provider costs, and impact children in special education programs. These are just guidelines. You can talk about this the way that makes sense for you, given your experience and given your concerns. And finally, step 3, make the ask. What you want them to do. I always recommend that you offer solutions wherever you can. What you want to do is ask your member to not support any version of the AHCA that includes significant cuts to the Medicaid program, and offer to work with them on alternatives that will increase the efficiency and cost effectiveness of the Medicaid program without harming people with disabilities. Here's a pro tip. Making visits is more impactful if you can bring a group together to deliver your message. Whenever you can, go in a group. Bringing in a mix of family members, people served, providers, and anyone else impacted by this bill is a great way to show unity around a single message. The AHCA will affect lots of different people in the disability community, so reach out to others and ask them to come along. Of course, if you can't get a group together, it's fine to go by yourself, but it is more fun if you bring more people along. Here's another pro tip. You want to know your audience. You will have a slightly different message depending on whether your senator is a Democrat or a Republican, as well as any individual information you know about them. This time around, we're asking you to visit just senators, and it's safe to say that no Democratic senators are going to vote for the AHCA as it currently stands. But your visit is about more than just how your senator is likely to vote. For Democrats, you can say that you understand that they're not going to vote for the AHCA, and you can offer to be a resource for them. It's not just about how they can help you, it's about how you can help them. Ask them what resources, stories, and information you can provide Democrats to help them persuade their Republican colleagues against making harmful choices when the bill comes up in the Senate. For Republicans, the stakes are high on this bill. Many of them have been part of a movement to repeal and replace the Affordable Care Act for a long time. Some of the things in the AHCA they see as positives, like offering more flexibility to states and making sure that able-bodied people aren't taking away benefits from more vulnerable populations. What you need to help them understand are the unintended consequences that would come from cutting Medicaid funding. So you want to go in not just asking that they vote against this bill, but you should also ask what resources and information you can provide to help them to not vote for something that cuts resources to people with disabilities. Okay, here's your final pro tips. Do's and don'ts. You do want to listen actively. You do want to anticipate and overcome objections. You want to dictate the direction of the conversation, and most importantly, talk about your own experience. A couple of things not to do. Don't assume that the staffer has knowledge or a lack of knowledge. Don't go in with any assumptions about what they know. Don't talk about other rules or laws or issues. Stay focused on the matter at hand. Don't get argumentative or confrontational. Stay polite and calm throughout the meeting. And don't bluff your way through questions you can't answer. It's okay to say that you don't know the answer to something and offer to find out and follow up with it later. Now, before you actually head into your meeting, I highly recommend that you do a role play. Assign one person to be the staffer and everyone else can be participants in the meeting, and just talk some of it through. It sounds a little corny, but it really helps, and it will definitely make you feel more comfortable and confident going into your meeting. After the meeting, it's very important to follow up. Decide who within your group is going to send a thank you email to the person you met with. Include any information that you offer to follow up with, as well as electronic versions of any leave behinds you have. Make sure to snap a picture with your member or staffer if you can, or at least with your group before you leave the building. You can tweet it to @TheRealAnchor using the hashtag DisabilitySOS. And make sure to let Anchor know who you met with and how your meeting went. Do you have any questions? Please feel free to reach out to any of us on the GR team. That's what we're here for. Doris Parfit-Claude, Anchor's Government Relations Manager, is the lead contact for questions on coordinating your visits, talking points, resources, and anything else you need the day of. You can contact her in advance to get her cell number in case you have any last-minute questions. But again, any of us are happy to answer any questions that you have. I'm going to leave you with some links and resources. First off, please let us know if you can come to DC for a fly-in day on June 6th by completing this short SurveyMonkey survey. The link is on the screen there for you. That's just going to help us plan a little bit better for the number of people that we have actually coming into DC. For talking points and other resources, visit www.disabilitysos.org. And remember, if you have any questions about setting up Hill visits or about the resources available or anything logistical, please contact Doris Parfit-Claude. Her email is up on the screen there, or again, any of us is happy to help you out. The final thing I'll leave you with, and I do hope that you found this webinar informative and you feel better prepared to go into your visits. You can forget all of that. The most important thing is to just go in and tell your story. That is the way to have a successful Hill visit. So thank you so much, and good luck on your Hill visits or your in-state office visits. Thank you.